Okay, so switching gears to the PC party platform. So I remember when the People's Guarantee came out in November, there was reference to a dental program for low-income seniors in that document. And as we've seen as the elections unfolded, the new PC leader, Doug Ford, has in fact adopted certain planks from that platform, not all of it. It was 90 pages, and he's run sort of a much more concise platform. By the way, the PCs are saying that they will release a fully costed platform before the election's over. So far, their leader has been kind of putting out a plank a day, announcement of the day. But he's talking about adopting this program of his parties that would see low-income seniors having their dental care fully covered.
Yeah, in fact, I found that interesting because when he was on this show, he actually mentioned that of the things that he kind of agreed with in the People's Guarantee, one of them was extending dental care to low-income seniors. All right. And so he did, in fact, move forward with that, and he came out with an announcement last week about this. So the idea ultimately is that if you are of a certain income, that you can somehow, and the details are coming, receive some reimbursement for coverage of your dental expenses.
So I think that the numbers they've put out is they anticipate 100,000 seniors being covered, and the program would cost, once it's operationalized, about $98 million a year. So on the drug plan, and we do a lot of work for the Pharmacists Association here, a low-income senior for drug plan purposes is a single person that earns about $19,000 a year, and for a couple it's about $36,000. Certainly not big money. So what a senior who earns, say, a single senior is at $18,000 a year could look forward to is that his or her dental work would be fully covered by the government. Is that what we're looking at?
It depends. I mean, the details are not fully there yet. I mean, so there's different delivery models. Can they go to any dental office in their community and then get reimbursed for that? It's, with potentially some prior approvals, like the Healthy Smiles program. That's one way of doing it. They've also mentioned that you can go the government would be investing in community health centers and public health units as well to provide dental services directly out of there. So seniors potentially could go to those locations. So there's different ways of going about it, and it's one of the key things I've noticed amongst all the parties is that with respect to dental, some of the details are not fully baked yet.
Yeah, I think that's new to government largely, and so details to come, as is often the case in election time. But what are the PC saying about long-term care?
With respect to long-term care, they're looking at maintaining the same promise that the Liberals and the NDP had with respect to building 30,000 beds, except they want to accelerate that. So instead of 30,000 beds over 10 years, they would continue that, but instead of 5,000 beds over 4 years, over 5 years, which is the Liberal commitment, they would build 10,000 beds over 5 years.
Is it 10 or 15?
Oh, sorry, 15. My apologies.
15,000 over 5 years.
years.
That's pretty ambitious.
Very ambitious. There's an approvals process, there's a licensing process, an inspection process, hiring up. So a lot goes into development of a new long-term care home. In fact, there's also the aspect of space. In the GTA, or specifically in the city of Toronto, there may not be the real estate sites that are to build, but maybe outside of the GTA, there would be more of that capacity. So it's tough, it's ambitious, but he's clearly viewed that as a big priority.
Now, the Conservatives, are they silent on pharmacare? What are they? I haven't seen or recall hearing much from them in terms of the OHIP Plus program for the birth to 24 and this over 65s. Have they articulated a position on pharmacare? I don't recall one.
Yeah, one of the things we need to look out for, especially with the cost of platform, is to determine whether or not they're going to keep the Liberal plan as it relates to OHIP Plus for those over the age of 65 because that's slated right now and budgeted to take effect August 1st, 2019. So that's something to look out for. So far, publicly, they've committed to, in a variety of different comments, to keep OHIP Plus as it stands for those under the age of 25. This is something that Christine Elliott has mentioned as well in various public settings as well. So I think that we can expect, at the very least, that OHIP Plus will remain under all three parties. But the question about extending that to those seniors is not 100% clear with the Tories. And then those between the ages of 25 and 65, recall that the Liberals decided to move forward with some sort of a reimbursable up to $700 for your drug expenses and dental. Nothing from the Tories on pharmacare for that group.
Of course, in the background, the federal government, under the leadership of Eric Hoskins, who's been hired to be the national pharmacare guru, might make all of these discussions moot. I mean, if the federal government goes forward with a complete all drugs for everybody kind of program, then really there's not a lot of decisions for the provinces to make, is there?
Right. I mean, I think what Kathleen Wynne was doing at the very beginning, similar to what she did with respect to the retirement issue and the pension issue, expanding CPP so that it provides greater pensions, to be able to set the tone with OA Plus in terms of what a national pharmacare program could look like. But right now, I think that they're in the middle of their consultations. Eric Hoskins is in the middle of their consultations, and by the time they come back and come back with their final recommendations, you're right, it could be all moot.
So the last thing before we switch over to NDP is Doug Ford and the PCs are talking about ending hallway medicine, giving hospitals the resources that they need in order to provide more and better care, more timely care, and get rid of this backlog. So beyond the long-term care beds, I haven't seen a number put to that yet, and I have seen Ford talk about he's going to consult with frontline experts. He says, I'll talk to the doctors, I'll talk to the nurses, I'll talk to the hospital administrators, and they'll tell me how to do it.
Right.
Bit of a risk, right?
I think that people are going to be expecting a number. The NDP put forward a figure of a 5.3% increase in base budgets for hospitals. The Liberals have put forward 4.6%. In fact, the NDP went above and beyond that and is committing to hundreds of millions of dollars for additional beds. 300, I believe they said 300 beds that they would be putting forward. So so they've put forward their details, and I think a lot of people are going to be asking Doug Ford, what resources are you going to commit?
Yeah, and maybe we'll see that in their platform document, but right. It's certainly, I think, when we ask people in the field, how do we go about solving this problem, it's usually expressed in a dollar figure. That's right. So that's going to be a bit of a challenge.